Hello, I'm Professor David Dunaway. I'm Professor of Craniofacial Surgery at ICH and Great Ormond Street Hospital. My interest clinically is looking after children with congenital craniofacial deformity, particularly those with craniosynostosis, which is a condition that causes abnormal face and skull shape. And you can see here an example of a printed skull of a baby with craniosynostosis and how abnormal the face is and how abnormal the head is, with a very constricted head and not enough room for the brain to grow. So treatment of these children involves understanding face shape and normalising it. But it's such a complex problem that we find it very difficult as surgeons to understand all the nuances that are important for treatment. And that's where this project of statistical shape modelling of faces and heads comes in to help with craniofacial surgery. We've done a lot of work with our collaborators in engineering and computer vision science at the Institute of Child Health to understand these problems and help inform us about how we can make better operations that are both more effective, simpler and safer for the children that we operate on. Now I'd like to introduce Thanos, who will tell us more about statistical shape modelling and how this applies to craniofacial surgery.
Hello, I'm Thanos Papayanu and I'm a postdoc at the Craniofacial Group UCL. I'm a computer scientist and in this project we will try to create some statistical models of 3D shapes of a human head. So even though there are some models now, these models are of small populations and they don't include some syndromic cases. In this project, we will focus on creating some statistical models for large-scale populations of healthy individuals, as well as for people with syndromes like Apert, Curzon, and Treacher-Collins, etc. So we will use some machine learning techniques like Gaussian process and deep neural networks, and we hope that this will have an impact in many fields. And now I will hand over to Sylvia to talk about UCL.
I'm Sylvia Schiavano. I'm an associate professor at UCL and I'm an engineer by training, but I've been working for the last 15 years at Great Ormond Street Hospital for Children. This is a great environment because you have the opportunity to combine the basic science from UCL together with the clinical information at Great Ormond Street Hospital for Children. This is a great project because we'll give the student the opportunity to combine basic science, image processing, analysis, and information together with clinical data from the patients at the hospital with the potential impact to really develop new treatments for these children that are born with craniofacial diseases.